Hi, I'm Dr. Mitch Harris. I'm currently the chair of orthopedics at Mass General Hospital. You're listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Mitchell Harris, Chief of Orthopaedics at Massachusetts General Hospital. Dr. Harris is a widely respected and beloved teacher. He received the coveted Golden Apple Award presented to the Harvard Orthopedic faculty member identified by the residents as a Teacher and Mentor of the Year. He also has received numerous faculty teaching awards in his previous academic position. Among his many accolades, Dr. Harris received the BWH Hippocratic Society Humanitarian Award and both held the chair position and served as mentor for the AAOS's Leadership Fellows Committee. He is the inaugural recipient of the Stepping Strong Distinguished Chair in Orthopedic Surgery. Dr. Harris chaired a Department of Defense peer-reviewed orthopedic research program and has authored or co-authored more than 150 peer-reviewed academic publications.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Mitch Harris, Chief of Orthopedic Surgery at Mass General. Doc, how are we doing today?
Good, thanks. Good to see you.
Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Well, I think most young surgeons, when they come out of medical school and jump into residency, really want to become the next savant surgeon. Ideally, in the shortest period of time, and quickly to become very adept. But you soon realize that in order to get there, it takes reps. This is all about Malcolm Gladwell's 10,000 hours, whether it's Steph Curry trying to hit three-pointers or Yo-Yo Ma learning how to be a good celloist. The bottom line is lots and lots of time at your particular area of interest. So my goal, getting into orthopedics, check that box. Once I got into the residency, I wanted to quickly ascend to being as good as I could in the operating room. And that just takes reps. So my goal was reps. Whenever I had a chance to get back in the OR, get back in the OR. So that's really the prominent theme during residency. And then the second part of it is, what area of orthopedics do I want to pursue? Because it's such a large field, from pediatrics to oncology to hand, to sports, to joints, to trauma, to shoulder. Every body part has become a subspecialty. So the second part of my journey was to figure out what, in fact, I wanted to focus on as I went on into my career. I quickly recognized that I was a trauma junkie, that I liked the adrenaline that went with trauma, and I liked the uncertainty of it, and I liked to know on my own that I could handle things that came in at a drop. So I needed to be available and know what to do. So trauma became my primary interest, and I pursued that. During the course of that, I recognized that when really severely injured patients came into the emergency room or the trauma unit, and they had trauma that we were familiar with, the next step was to get the AOK from spine surgeons. And notoriously, the spine surgeons were not the same personality of the adrenaline junkie. And it was very frustrating that we would often be waiting for the spine surgeon to come down and give us their blessing on proceeding on with what we thought was urgent. So then I thought, well, maybe, what if I learn both? And then I don't have to wait for the spine surgeon to give me the AOK. So when I was finishing up my residency, I recognized that I really wanted to have the expertise in both trauma and spine, and that led me to my fellowship journey.
So taking us through your fellowship year, what was your mentality and then heading into your first job search, and how that perspective changed the beginning years of your career?
Well, similar to residency, when you get into fellowship, you start realizing you're getting closer and closer to leaving home for the first time and being the responsible surgeon. So my goal during the fellowship, again, was reps, number one, reps, number two, reps, number three, and number four was networking and getting comfortable with making decisions that I was responsible for. So I was lucky during my first fellowship that I got a chance to spend some time in Switzerland with some other experts in both the fields of spine and trauma. So both of the fellowships that I did involved both spine and trauma, which kept me straddling those specialties throughout. By the end of my fellowship year, I was really looking for a job that would allow me to continue to pursue both spine and trauma in an academic medical center with a busy trauma center. So my goal was pretty clear when I started trauma fellowship that I wanted to end up in a big trauma center and doing trauma and spine.
Throughout your career, did you ever consider going private practice, or are you academic focused all the way?
It's really hard when you start off in a residency to ever really experience what the private sector is like. And although oftentimes residencies have rotations, it's not the same as being with your gaggle of other residents and the core, the esprit de corps that goes along with being in an academic center. And I was always intrigued by not knowing enough. Inevitably, somebody would ask a question and your answer would be, I don't know. And I felt like those questions were imperative to my personal growth and maturation as a surgeon and as an academic surgeon. And so my propensity was always to stay with academics. At some point, you start talking to some of your buddies who are in the private sector and you realize, well, they got it pretty good. It sounds like a pretty good gig, and am I really committed to academics? So you explore them, and I explored a couple of opportunities, but at the end of the day, the idea of being in a private practice never drew me close enough to leave the academic sphere.
Can you kind of take us through your journey on how you became chief at MGH?
Sure. In short order, it's pure luck. But, really what happened was I had spent some time in different places. So when I finished my fellowship, I was single. So I had a vote of one of where I was headed. And I looked all over the country because why not at that point? And I looked from San Francisco to DC, from Chicago down to New Orleans, and a lot of places in between, and ended up finding my sweet spot in New Orleans. I'd never been there before. I'd never been in Louisiana before, but I thought it was a great way to start my career in a very busy charity hospital trauma center with a real paucity of talented spine surgeons in the area. So usually when you take your first job, you want to get at least 2 years under your belt because that allows you to take your board certification. But you're constantly reminded of the incredibly high rate of changing jobs, first within 2 years and then within 5 years. And I think it's something like 50% within 2 years change jobs. So I went there with the idea, if this doesn't work out, I'll get my 2 years, I'll get some more reps, and then I'll move on. Well, 2 quickly became 10. At the end of 10 years, not only was I busy, but I was busy, married, and had 2 kids. So I realized I needed some balance in my life, and that led me to my second job, which was in Wake Forest, which is in Winston-Salem, North Carolina. It's a beautiful town, college town, and the challenge I had was to create a trauma service in a very busy orthopedic department where everybody took trauma call with a lot of people not too happy about it. So I had a challenge ahead of me, and I stayed there 3 years, completed the challenge, wrote a nice orthopedic paper about the benefits of having a trauma service, and then was recruited up to Boston at our sister hospital, Brigham and Women's Hospital. So I was there for 13 years and ascended through within the department and within the hospital and made some really good connections. And when the Mass General Hospital job came up, I was invited to interview from Brigham to come over to General. So just a change in zip code, no change in housing, no change in corporate structure, but a much different culture. And I've been here now for almost 3 years.
What would you say were some of the keys to your success that shaped your early career as you climbed to the top of your industry?
It's a very simple recipe: affable, available, and ability. And I can't overestimate the first two. The more you're willing to listen and really be affable and approachable, the easier it is for people to come to you and ask you for help. And there's plenty of other doctors, both orthopedists and non-orthopedists, that deal with musculoskeletal problems that are outside of their specific area. And they just want to know, am I doing this right? Or do they need to be seen by somebody with a more subspecialty link or perspective? So being approachable or affable is really important. The second thing is never say no. You can always say, I took on too much, but never say no, because people are asking you for a reason. They're asking you either because they respect your expertise or your opinion, or that they're overwhelmed and they need your help. So if at all possible, always be available and always say yes. And then keep honing your skill. At some point, it's all about your own personal results and how you feel you're doing compared to what your personal aspirations are. Every time I go into a fracture case, I look over the operating x-rays and say, okay, this is how I want it to look when I'm done. And if it doesn't look like that, I continue to aspire to make it look like that the next time I go into a situation. So it's affable, available, and ability. And then just be a good person. People respect surgeons and doctors and people in general that are good people. So be empathic and welcome people to your world and try to help them. That's never going to hurt you. It can only help you in your career.
What advice do you have for graduating residents and fellows entering the professional job market for the first time?
I would say that, make your list of pros and cons, but ultimately listen to your heart or your gut. It's not about just strict data. I give this example to the residents all the time. When I was looking for my fellowship, it was between two very different programs. And I put my pros and cons and went through it and was really having a difficult time figuring it out because both of them had very different appeals. Well, it turns out the program that I selected was in Toronto, and that's where I met my wife. Now, that wasn't part of the pros and cons. There's nothing about that, but that, in fact, was the most important decision I'd ever make, and it was one that was not on the list of, will I meet my mate? So I think there's only so much that you can gain out of your pros and cons. You have to go to the place, see if it feels right, see if the people there are happy, see if they're happy to have you there, because there's nothing like being recruited and feeling valued in the beginning of your career. You're going to be busting your butt. You're going to be working really hard. You want to know that you're surrounded by people that will be supportive and actually want you there. So I think the most important thing is do your homework. You can make your list of pros and cons, but at the end of the day, make sure it feels right. If it doesn't, there's something wrong about it. The other thing I would strongly recommend, particularly in this volatile healthcare field, is to make sure you have somebody looking over your contracts. I know with the COVID going on recently, there's a lot of disappointed people that had jobs that suddenly disappeared, and it's pretty hard to argue. But if you have a contract, it's a little bit different discussion. So I think it's really important that you have somebody help you review that and make sure that that represents your understanding of the situation as well as theirs. Give a good example of that. When I moved to North Carolina, I was all set to go, but my license wasn't ready. And I remember the chairman saying, well, do you still have your license in Louisiana so you can still work there until your contract is completed? And I was mortified. I'd moved my family up to North Carolina. I'd filled out all the paperwork, but it was caught in some kind of bureaucratic logjam. And there I was, thinking I was starting. Well, my contract was starting on that date. That's how contracts work. So they protect you as long as you're doing the right thing. And I think it's really important that you have somebody reviewing it for you.
With the world basically being virtual right now and a lot of these annual conferences going online, what advice do you have for the graduating class regarding their networking and outreaching process?
Well, I can't emphasize the importance of networking enough, particularly in the professional academies now. It's really hard. And if you don't know somebody, networking is particularly difficult. So I would say get comfortable in front of a Zoom, get comfortable in front of a lens, make sure that you can portray yourself the way you see yourself. And that sometimes takes practice like anything else. It's amazing how we've gone from hardly ever using Zoom for telehealth to now 20 to 30% of all our visits are telehealth. So you will work through it, but again, it goes back to reps, and it's going to be important. The other thing as far as networking, when you get into a society or you're into the academy or you're into a subspecialty program, make sure you start meeting people that are your age and your level so that you feel comfortable not being so exposed and vulnerable to these iconic figures that you've read about and read their articles. It's really important that you feel comfortable so you can be yourself, because when you're yourself, you portray yourself the best way to others. So it's really important to feel comfortable in front of a lens and feel comfortable looking in the mirror saying, am I representing myself accurately?
Can you talk about your involvement with professional societies?
Yeah, that's a really important thing when you're in academics. And I've had both the fortune and the struggle of having a foot in both the trauma world and in the spine world. So when I would go to professional spine meetings, everyone would say, oh, are you going to tell us about spine trauma? And when I go to the trauma meetings, they're going to, oh, you're going to talk about spine trauma? I said, no, I do other things. other than just spine trauma, and I do other things in trauma other than spine trauma. So I think it's important that you find your niche, but be passionate. If that's what you like, pursue it. Be available for committee involvement. You go to the business meetings, walk around, meet people, introduce yourself to people. It's a big world, but it's got very small professional societies, and they overlap a lot. And that's how you're going to meet a lot of new people and increase your network. So get involved early. Volunteering is an important part of our mission as far as physicians be out there helping others.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.